The Cannabis Training University Master Certificate Program of Cannabis, Integrative Cannabis Medicine and Department of Thai Traditional and Alternative Medicines. Ladies and gentlemen, please join me to warm welcome Dr. Supaporn Milab, the speaker for this section. ขอเรียนเชิญค่ะ
Hello everyone. My name is Dr. Supaporn Milab. Personally, I am an anesthesiologist. I have been working for 27 years. The work is related to pain, and I have already studied general practice and kept working all the time. Until one day, my family member was sick. My relative had cancer. We reached an impasse. The disease was inoperable and incurable. Then cannabis as a potential medical treatment emerged. I concentrate on my study for 3 years and another 3 years when cannabis is legalized. So it is a total of 6 years. But in these 6 years of experience on my job, I will pass on my experience as a life textbook. Now we are studying life textbook. For general textbooks, we can read them anywhere, particularly by searching Google. When we type cannabis is medicine, all result we need will come out. This is important. What is the potential use of cannabis mimetic in the treatments of cancer? It is the potential of all substances which work collectively as a group that has many mechanisms for treating cancer. It cannot be treated by any of these substances alone or a single substance. My experience as just described, I intentional study Cannabis Training University Master Certificate Program or CTU. I help them advertise the course because they taught quite well. So they have produced many medical cannabis doctors in Thailand. In Thailand, you can study whatever you want, but the most important is that in Thailand we must obtain a certificate. What department asked me to do, I do all that they wanted. I want just to be a doctor treating patients with cannabis because I have already know that it is really useful. Cannabis and hemp also have anatomy which many people talk about. They have trunks. They are like humans and other creatures. They have roots, stems, branches, and leaves. Everyone only talks about extracting medicine from its flower, right? But in fact, it can be also extracted from roots like human legs. There are so many substances in its roots. Substance contained in cannabis be divided as follows. As we work on cannabis, we have a class of the cannabinoids and non-cannabinoids. If it is cannabinoids, there will be group T and C substance like yin and yang. T is strong and intense. C is like yang, which is soft and gentle. It is like one group to heal pain and another to repair. If we use them together, they will be a very good balance. Another group is non-cannabinoids, terpene and flavonoids. Terpene which give off a smell. The smell is a very good healer, but it is still unclear about its doses. Cannabis with a nice smell is a good medicine like a woman. Cannabis strain using the word flower is female and virgin. It is a very good medicine. The older, the better. There is full of good medicament in its flower. Terpenoids are fragrances. Flavonoids are colors. Beautiful colors are flavonoids. But sometimes they are called the substance P or vitamin P. We will hear more about them. They have been sold in purified form which are very expensive. Nowadays they are available in Shopee, but in fact we have all of them. So it is no need to buy. The chemical precursor of cannabinoid is CBGA. It can be transformed to be anything by heating or aging or just leaving it. When we heat CBGA, we will get THC and Clan C, such as CBD, CBG, CBN, and so on. And if we leave it for a longer time, we will get CBN. This CBN acts quite well. Later, we were afraid of being too enjoyable. Then we only focus on using CBN to work. It helps reduce pain. It can also be a sleeping pill and reduce symptoms of both gout and arthritis. So you sleep immediately before enjoying yourself. Temperature is very important. We need to know what level of temperature its substance will evaporate so that we can distill it. No matter whether we distill and throw it away or distill and keep it. If we extract the substances by putting them in a rice cooker, it's called an open system. The smell will disappear. But if it is in closed system, the smell can be stored. This will be very expensive medicine. There are many fragrances called Big Six, which are pinene, linalool, caryophyllene, myrcene, limonene, and humulene. Pinene from pine bark is good. The scent of linalool is good. We have already smelled it anywhere. What is caryophyllene derived from? Is it derived from clove or ganplu? The clove relieves cough by clearing phlegm or sputum. It can be effectively used to treat pneumonia. We can put it in special mouthwash or use it in an oral spray to treat a sore throat. If you come closer to me, you will catch various smells like acrylamine, cannabis, and throat spray. This is because I am afraid of COVID-19. I have not been infected so far because I use all forms of cannabis extracts only in small amount to protect from the disease. Myrcene is a plant that belongs to the group of mangosteen. Someone may say that if we use Thai mango with cannabis, it will be good medicine. Foreigners use it for recreation. We use it to treat cancer. If there is a sense of myrcene, limonene is orange. We smell its fragrance to heal our lungs. Please remember, the smell is a very good lung healer. What we do have to do make cannabis smell good. We can even extract its smell and mix the smell with drinks such as coffee. Why the smell of humulene is like muddy soil? In the past, people asked me why this cannabis smells stinky. After smelling it, I realized that it was a muddy soil smell. Regarding temperature, if we assume that we know the boiling point, we can distill and store them. They sell the scent separately at a very high price, even higher than THC CBD. We are still running after them. Now I am talking about THC CBD. Personally now, they are CBN and terpene. I am trying to write a textbook and bring you to study cannabis in an easy way. Can you see the colors? Vivid colors, red, green, and purple. All of these are from its bark, aren't they? They are used to treat cancer. The purple substance is used to treat colorectal cancer. All of us have heard of purple rice. Do you notice that purple colors? Its little matter. Purple is a very good medicine. Something strange is good medicine. So please remember that. The color must be bright and beautiful. However, the white color is not good. Have you ever heard that when you get older, do not eat something white? Do not touch, do not look at, and do not be close to it. This concept can be applied to everything. We can take cannabis orally into our bodies in various forms. Creating tinctures is the extraction by using alcohol. They are called tinctures, don't they? Their flowers or vaporized flower can also be taken. In addition, we can take them in form of topical. Some doctors did the research. William Courtney has worked on almost 300 researches only on the cannabis leaf. Therefore, cannabis leaves are very useful. At first, one would say, oh, take it to the animals to eat. It is not. Do you understand that the leaf is a perfect medicine? This is because the leaf is a superfood. You can blend it with smoothies. It can treat and change our gastrointestinal tract from the mouth to the anus. There are a lot of bacteria called microbiomes in our intestines. It's family of bacteria that we already have. If we change it to good bacteria and very diverse like a jungle of bacteria, our body can fight every disease without using the medicine. Therefore, personally, there has been almost no antibiotics in my body for 5 years. All are the result of using cannabis. This is about the metabolism in the body. Receiving into the body is from the breath-right. Inhalation is quite fast. Sniffing will immediately go to the brain. Drop under the tongue will go to the brain within 5 to 15 minutes. It will take up to 45 minutes to 2 hours if we swallow. Its effect will last up to 12 hours. People only know about THC, but in fact it has to be converted to 11-hydroxy-THC that is more active, effective in spite of receiving it in small amounts. Then it can be excreted by metabolizing in the liver and discharged by the kidney. In the liver, there will be up to 2 cycles in the intestines. This is called enterohepatic circulation. Thus, if someone asks how to expel cannabis poison, don't forget that activated carbon powder is still useful. It will stop the absorption and then discharge. This is another way of detoxification by using activated carbon powder. Personally, I can apply this method. The powder can detoxify if we use it with cannabis. The patient will be less intoxicated, but its constituents will remain in the stomach. This is used to treat stomach cancer. I can treat stomach cancer leading to death within 4 months. The patient will survive for 1.5 years without chemotherapy. The patient's quality of life is very good. This is a case of a 72-year-old guy who took care of her bedridden 93-year-old mother. When her mother passed away, she just passed away peacefully without chemotherapy. And this case lasts for 1.5 years. I have a cousin who has stomach cancer. She could survive for 4 to 6 months and then died. Although I did my best, there is no best in the medical profession. Why do people survive by using cannabis? Therefore, there are all forms. If we smell, it will treat nasopharyngeal carcinoma. Thus, sniffing is not only for recreation, but it is also for a medical treatment, which is a kind of bringing medicine into the body. It is simply called the fumigation or vaporizer. Nasopharyngeal carcinoma is in the nasal. It is difficult for us to treat it with radiation, but if we fumigate, it will dry. We have a nasopharyngeal carcinoma case with us right now. A patient underwent 33 radiation treatments and 33 chemotherapy treatments, and he will die. His face was completely black and full of fascia around the neck. But when we use cannabis, he is still alive. And in case of injection, like I said, in the reports which I have received from other countries, people are poisoned by unintentional intake, such as eating leftover food. The poison must be kept out of reach of children and pets. Being poisoned is not the result of inhalation or dripping. Dripping cannot be done easily. It must be done by humans. You definitely cannot drip other things while hanging out after dripping is neither enjoyable nor cool. Smoking is a matter of treating the lungs. Someone who has COPD or emphysema had to smoke. The best smoke had to be done through the water we call bong or pipe. Is it the pipe in our country? To be trendy, we call it a vaporizer. For its activation, the amount of bioactivation is important. If we smell, we will get almost 100%. But if we swallow just only 1/3, then we have to consider what cancer we want to treat and where the origin of cancer is. We have to treat it at the point. Cancer is an abscess that keeps growing. It does not shrink and disappears. What will we do? We have to treat its cause. Therefore, we have to consider what types of cancer to be cured by appropriate types of treatment. Knowledge is needed. Besides, there is a cannabinoid test, 11-carboxy-THC, that had been done to so far. That is the urine test. In fact, there are more excreted cannabinoid, 11-carboxy-THC, in stools, but it is inflexible and inappropriate. So, it is done by a urine test. Receiving in the past, people talk about cannabis is a scary way. It is a narcotic and there is no antidote. The antidote is not needed indeed. You sleep and wake up automatically by yourself. It is no need to do anything. It is not like liquor or anything else. Let them get enough sleep. When they wake up, will only be hungry and ask for food and dessert. That's all. There was a case that the patient slept for 15 hours. It was so long that this cousin thought that he has died. This was a brain cancer case. His body was moved out of the hospital. It appeared that he woke up while the monks were chanting. This case was in Lamphun province. After getting up, he said that he was hungry. This was a true story, but it did not appear in the news. So cannabis is the sleep and wake up by himself. I always tell patients that cancer cases are very painful. Do you want to sleep or die in agony? You don't have to be afraid of using painkillers because the pain is very suffering. Its action is related to this. It doesn't receive exclusively. We are talking about cannabinoids, aren't we? There must be a receiver for cannabinoids. It does not exclusively pair with itself. It pairs with other receptors. For example, please see from top to bottom. If it is mu receptor, it will begin to reduce pain. Its action is like morphine. If it is serotonin receptor, it will reduce stress. The body will not be in pain. We are happy. Have you ever heard of neuritis that was very painful for a patient? So he decided to commit suicide. There is a textbook that we have to teach this directly regarding neuropathic pain in Thailand. We have a lot of single cases. If this disease comes across cranial nerve fiber 1, some people may want to die because it is a very painful. It is a terrible headache. Cannabis will be a very good healer. The best pain reduction is to reduce pain to the level of seizure suppression. Have you seen it? Paracetamol and NSAIDs will increase to the level of morphine. Finally, why are there anti-anxiety and anti-convulsant drugs? It is because we have to manage the pain to the level of seizure suppression, so the pain will disappear. Then sleep. When the pain is reduced, we can sleep. After sleep, there will be another medicine such as morphine. It will cause respiratory depression. It is difficult to breathe, breathing like a being in a cage. Has anyone ever had morphine? Breathe, but the chest Don't move. Breathe through the mouth, not through the nose. But if it is cannabis, the patient can breathe. So it causes a condition that some doctors in palliative care do not like. Because panting still remains. Is it easily noticed? They do not want to see panting. Is it trying? Thus the mixer is useful. Morphine and cannabis can be mixed. There are advantages. Morphine causes respiratory depression. It will slow down the pulse. This action cannot be found in cannabis. Using them together will reduce pain and promote better sleep. But there is no further respiratory depression in the case of other receptors such as orexin. This is related to hungriness. Ondansetron is already active. Its action is similar to cannabis. When they say that using cannabis is to reduce nausea caused by chemotherapy, this is true because they compare it to placebo, not to ondansetron. However, ondansetron is much better. It is about other receptor like other cytokines. This is to reduce the spread of cancer. So cannabis can be paired with all receptors, but it is purposely active only in the problem area. This is very special and rare. Personally, I would say that a gland under our brains called the pituitary gland, with command for all good. So I still like dripping under the tongue, this for CBD. But in the case of THC, I will tell you how to do it later. Endocannabinoid is in our bodies. It is a housekeeping system, like a maid who disappears after finishing cleaning up. But in fact, it is like a president who can control every organization. It is as big as endorphins. Therefore, endocannabinoid is in our bodies. It is in presynaptic and postsynaptic membrane. Very strange that it is everywhere. And for external, they call it phytocannabinoid. It is synthesized. This is called synthetic cannabinoids. Why phyto has a safety margin that is almost 20 times higher than synthetic? Because we say that it is from plants. We will not say what foreigners have taught us. Thailand's textbooks are very better and safer. If we lack cannabinoids, we have lacked for over 80 years because they are classified as narcotics. When we take small amounts, some people are refreshed. Some people who take CBD only 1 to 2.5 milligrams said it was like drinking coffee, but more relaxing. It is not tied at the back of the head. It is fresh as well, but the neck and shoulder are more relaxing. It is receptor. Professor Thirawath Hemajutha said that there was no need to read it yourself. He has already read it. It is very difficult. Remember that it can be paired with every receptor, but it is active only in a problem area. Everything is provided as the entourage effect. It comes in a cluster. They tell us that isolated CBD is pure CBD. Foreigners are smart. They remove chlorophyll and others and separate them into groups and then put them together again and sell them to us at a very high price. They sell ranking from extraction equipment to substance examination to us. But why do we have to waste our money? If we start with a good strain, we know that we treat in clusters. There has been research that treatment with plants bringing the substance into a group will create entourage effect that is more beneficial than treatment with a single substance. For example, using pure CBD 25 mg per kilogram per day can treat apoplexy or epilepsy, but CBD enriched can be taken at only 6 mg per kilogram per day to control these symptoms. It is a huge difference. Someone may say that it can be used, but if we use it too much, it will interact with others. It must be used sparingly and produce a successful result. This is called an entourage effect. The dosage is small. This may be because there are cannabinoids, non-cannabinoids, flavonoids, and terpenoids. There are all forms of taste and smell. For example, we drink orange juice from organic farms. Freshly squeezed or powdered orange juice, which one is tastier? This is cannabis work. That is why we try to encourage everyone to grow it and find a good strain, and then make medicine in a natural way that we can treat ourselves. The doctors are tired. One doctor had to take care of more than 20,000 patients. There are 60,000 doctors, but only 30,000 doctors actually work. They have families. The doctors are like us. They are born, come to old age, sickness, and death. Personally, I want to tell everyone that I will take myself as a light textbook, but I don't want to be a legend. The textbook is to show that a person who has been sick stays strong with cannabis. I am 50 years old now, but I am stronger than before when I was a new doctor. At that time, I was all ready to die and sleep all the time, right? If we want Thai people to be strong, we have to help each other, create a book of life. Foreigners have synthetic cannabinoid. It is synthetic THC. There are many names such as Marinol and Dronabinol. That dosage, which is available in capsules. Its effect is to increase appetite, reduce nausea and vomiting, reduce pain, sleep aid, and loosen up the muscles. We also have it in Thailand. We have Metaosot. The indications are exactly the same. When we made the original, I have to admit that it was very intense because we tried to extract it intensely, but the dosage was too high. We tried to balance it as foreign countries did. The effect is the same. Do you see that? It reduces pain, reduce nausea and vomiting. The word to reduce nausea and vomiting must be used before the symptom occurs. You cannot drip while having nausea. THC will boost appetite. It stimulates hungriness and sleep aid. Regarding neuropathic pain, we have a lot of neuropathic pain cases. It can also treat neuropathic pain, migraine, pain in the arms and legs, and pain after surgery. All are completely related. All of this can be put in palliative, but we have an entourage effect from Metaosot. What is Metaosot? Is it a Thai species? Our Sativa strain. We extract it. At first, it was intense, about 50 to 80 by volume, because we did it similarly to Rick Simpson oil. After that, we adjust into the right doses. It must be backed up with research. It will start with 1 drop. There will only be 3 milligrams of THC in 1 drop. If we drip it twice, it will be like we receive 1 capsule of morphine. It will reduce pain. Before the COVID-19 situation, painkillers were not prescribed because we could use cannabis to heal. Remember precisely that 1 drop of Metaosot contains 3 milligrams of THC, whose taste is astringent. It is a pretty good medicine with black color. The water is bitter green. Nobody is addicted to it. Patients ask me when they could stop using it so that they could celebrate. Since it had been used, none of the patients wanted to use it more. They wanted to stop. They wanted to recover quickly. The whole bottle 10 milliliter contains 810 milligrams. One person takes 810 and 10 milligrams without any other medicine. We have not died yet. I will say that it has a dosage that is research. Can cancer be treated? Why not? There are a lot of textbooks. There are called 82 methods. This textbook was translated by pharmacist พงศักดิ์สง่าศรี It is strict but he translated it very well. Read it and see it if it can really be done. There are so many methods that you may not want to remember. In the future, we will be able to increase the quality of life of the last stage patients. Regarding palliative care, now there are many doctors who work in palliative care. Many of them started from anesthetic work. I have been responsible for many pain cases. I was consulted. Then I could look through it until I understood that there must be an advanced care plan for people's life. We have to plan for 10 years in advance. We have to predict that will happen to our lives and how to respond to it. Do not die without preparation. I have prepared since I was 27 years old because I have supraventricular tachycardia and irregular heartbeat. I understand that feeling of sleeping in the ICU and having no chance to say goodbye to anyone. Since then, I have taken every breath to be beneficial to myself and others. Therefore, everyone must have an advanced care plan. There is research done by ICU nurses in England since 2019. It concerns dosage comparison. Let's expand and see that there is a clear dosage of how many milligrams of THC is equivalent to morphine. We can apply it. Everything has no fixed rules. Even morphine is still 1 to 2 milligrams per kilogram per day orally. Right, that THC is similar. Taking about 1 to 2 milligrams per kilogram per day can reduce pain. We can compare their dosages. The receiver in the brain is in the area of the medulla oblongata, which is the respiratory center. It controls respiration and pulse. Morphine will depress. How does it work? It will keep our brain staying still, falling asleep, causing breathing difficulty and making us constipated and depressed, while the effect of THC is different. It will cheer us up. The pulse beats a little faster and no constipation. Someone say that cannabis is a cold medicine. I understand. It really reduces fever and does not make us constipated. This mainly because we can use Thai herbs such as tamarind, senna and triphala to help us prevent constipation. Modern medicine is hardly talked about when cannabis is used. Herbs are focused. Thus, there are a lot of receptors of opioid for medulla oblongata, but there are very few receptors for THC or CB1 receptors. They are very rare. We use it to treat brainstem cancer in children. It does not depress respiration indeed. I will show you later. THC is actually effective in reducing pain. If we use it with CBD, it will reduce side effects of each other. We should start at around 2.5 milligrams, which is close to the dosage of metaosode, right? After that, how do we use metaosode? We can use 12 drops a day. If you drip it under the tongue or swallow, you can take it almost every 2 hours in case of intense pain. I told a patient that I had just registered metaosode to use in palliative care cases. However, my experience showed that it can treat cancer. He can slowly dip like he is sipping wine but not let himself intoxicated, just feel a bit dizzy. He can still walk and be conscious because he is taking medicine. He must know. Is there anyone who takes painkillers and does not feel sleepy or dizzy? Taking ephedrine can make you feel sleep and then sleep. But if you are still in pain, you will not be sleepy because it is not a pathway bringing you to reach the point of falling asleep. When the pain is reduced, you will fall asleep. When you fall asleep, you will sleep. Sleeping a lot means passing out. You can pass out by using intravenous injection only 2 milligrams or 1 milligram of morphine. But it is difficult for THC, so it is very safe to use. That patient tried sipping it right while to treat throat cancer. He really did it, leaving him for 1 month. It appeared that the cancer had flattened. I saw his smile, but I said that I had asked him to do only 12 drops per day. But there has done many drops. He could ask for more. So he followed my advice. In foreign countries, if we open our minds, we can treat brain cancer. They use Rick Simpson oil, which is 5 times more concentrated than our metaosot, by dripping 3 times in the morning, noon, and evening. There is no day or night for people who have cancer. Everybody wants to recover. I told them to drip 3 times and gradually increase. It is like we eat more rice a day. Drip more drop, increase 1 drop a day. The body will be able to tolerate it. If cancer dies first, we will survive. If it does not die, we will die with it. How do we have to use medicine so we do not die? This is because its effect is great, but there are still side effects, aren't there? Like we are taking medicine. Someone said that it was an allergy, but it was not, I confirm. It is a coexisting symptom. That is theory. Mr. Rick Simpson made Rick Simpson oil. He was an engineer. He treated his cancer by himself and then came to teach abroad. Ending with metaosot. We have metaosot that 3 milligrams per drop of THC can reduce pain. Palliative care can be done, and if we use it a lot, it can reduce certain types of cancer. I will explain to you later why I say certain type. We have Karun Osot now. Metaosot is a Thai strain, but Karun Osot is a high strain CBD. I do not want to use the word foreign strain because we will be able to do like them in the future. Start from Charlotte Angel. This is a family whose CBD is outstanding later. We will make it by using our local hemp. This one is CBD 2.5 milligram, 0.5 milligram per drop. It's the opposite yin and yang. Now we have CBD 0.5 milligrams per drop. It's the opposite yin and yang. Yin seems intense. What I just said is reduce pain, but yang must be lighter. I must be gentle. It must be gentle because we are going to treat brain symptoms and various allergies. We will mainly use CBD. Initially, we used about 2.5 milligrams for 5 drops. These 5 drops should be dripped 1 to 2 times. It can be used to treat diabetes, so there is no need to amputate the leg. It is a high CBD strain classified into our local hemp. Do it with MCT type of coconut oil. You can read more detail later. Please remember this dosage so you will know how to use it. Here it will be gentle and not be the same anymore. Use it to treat the brain, Parkinson's disease and Alzheimer's disease. It can reduce the side effect of metaosot, which we use just now, right? If we use them together, we can treat many diseases. But the medicine has not been yet available. It was sold out after the first lot had been released. This was because at first we could not grow a lot of hemp. Now Dr. Thewan Thanirat said that it was okay. Which one has no specification, we took it. He means the one that cannot be cannabis. We can do it here and try to accelerate the cultivation of this strain so that we can have more. There will be something like this. When I first started working on cannabis, people were scared of THC. When they experienced THC but did not experience CBD, they were scared of CBD. Personally, it is no need to be scared of anything, which is used in a very small amount because it will not interact with other. In foreign countries, they use CBD, isolated CBD. It is used quite a lot, around thousands of milligrams. but ours are start at 2.5 milligram. This CBD is full spectrum, which can be started treating the disease. So there is no medicine interaction problem. If we use CBD with warfarin and antioxidants, its function is similar to aspirin. Therefore, in an era where we are easily under stress and have ischemic heart disease or blood clotting problems, using a bit more CBD is beneficial. This is because the patient is not stressed and his blood vessels are not constricted. It will have a complementary effect on the treatment. It also reduces immune deficiency quite well because we use it in a small amount. If there is Karun Osot, everyone will fall in love with it. After we fall in love with Metta Osot, we fall in love with Karun Osot because it is very easy to use. When we have little pain, you can use it, but when it becomes serious, you can use Metta Osot. That it is easier for us to work. If we use them together in a small dosage, the result is good. There is no side effect. This year we can make Karun Osot. You have to ask the herb and Thai traditional medicine development. Metta Osot and Karun Osot can also be ordered here. The medical benefit of the use of cannabis. It reduces opioid, painkillers, and whatever irritates the stomach, including NSAIDs. As the next step, we will also have it in the cream form and patch imitating the derivatives of opium. I want you to use the term drug derivative. Let's help each other so that it will not be scary. It is not a narcotic. The fact that I am a doctor who uses cannabis first, if patients do not want to use it, we do not have to stimulate them. Mostly, they ask to use cannabis if they want. Do you want? Do you have for them? But if they do not want to use it, we just keep quiet. Just use the medicine that we already have. We understand the disease, study its history and read it carefully about what medicines have been used. It is possible that they can interact with each other. Understand drug interaction and the caution of using cannabis. Please study the patient's drugology history if they are allergic to cannabis. In fact, the allergy can be examined by genetic testing. It is called precision medicine. Dr. Pathomphong Sthapornphong is a medical technologist doing research with fellows at Rangsit University. It is like this. There are genes that are less effective at destroying medicine. This is better. This group is easy to be intoxicated. They can be asked a simple question. Do they get car sick, seasick, or sick of everything? We should think about this. The patient can be easily intoxicated if they get cannabis. We therefore will be careful by skipping genetic testing. Sensitivity to THC or the difficulty to destroy THC is around 5% in Thailand. All over the world is similar. Personally, there will be about 5 to 10% for CBD. They will synergize with each other right. We need to use it late first. Gradually start, gradually increase. If the patient can tolerate it, we can keep giving. This is genetic testing. We can fully talk about it when it reaches the point of the gene. I am going to present. I will start with 2 research on cannabis at the precision medicine level. We have to summarize it again. Everyone will be happy that we have real experience. There has already been genetic testing in Thailand. The use of genes of Thai people will be similar to those of the Chinese. They are unlike the European. Therefore, European textbook cannot be applied to the genes of Thai people. Why Thai people are good at drinking alcohol and getting drunk? There are a lot of fermented fruit. Therefore, being intoxicated with THC, if we do not take it with alcohol or other fermented fruit, the patient will be very intoxicated. Once I asked him the getting drunk with THC or alcohol, which one was worse? He replied that alcohol was. Cannabis is very beneficial. Let's see the real case. This case is a brain stem cancer. The cerebellar tumor is at the occiput. She is a half Japanese child who had been treated 3 times. The tumor has not wiped out by surgery. Chemotherapy could not be done either. The radiation treatment was ineffective. Then I used the original form of Metta Osot and Karun Osot to treat her. It could extend her life for 1 year, and she went back to have surgery in Japan. She had a good quality of life. Then she passed away peacefully. When will people in Thailand dare to say the word brain cancer in children? These children has no chance to grow up to be an adult. We must be kind and merciful to the whole family. Japan wrote it. Who had found this case? What would he do? Please do as much as she needs. Regarding cannabis, we use cannabis, but Japan had not used it yet. Japan is similar to England. It is quite difficult to create a medical formula. They only have hemp with its isolated CBD. But in our country, we can treat it. Japanese doctors were very appreciative of how we could do it. They did chemotherapy and radiation that could extend the life for only 9 months. Why we only use cannabis, we could extend the life for more than 1 year. We got 2 rounds. Her parents were in terrible conditions. We must continue doing the palliative treatment. We continue using CBD to treat her father. Karun Osot continued working. Her father got up and went to work. Then we used the family medicine system that we had learned. Took him to make merit. Went to the temple. His daughter already passed away, so he had to handle his feeling. And the only thing he could do was to make merit for his daughter. Nowadays, his family is very happy. Do you see the next? Do you see a lump on the left side of the picture? Is it a very big and painful? It is almost a new year or long weekend like this. Then she sent a message telling me that lung cancer spread to the bone. It is so painful that she cried. She spoke with a rural accent. I had cannabis for her. I had the original of Metta Osot for her. She had to drip 1 drop 4 times, dripping for a week, then increase to 2 drops 4 times, and then apply Zingiber Montanum Ply Balm mixed with cannabis on that lump for 14 days. She told me that they fought each other like in an action movie. It turned red around the lump. His accent was quite lovely. I thought that there was a receptor. It was really dramatic and it was exciting. It obviously became flat. Then she came to receive medicine from the hospital. Big lump, fatness. This is the success of Metta Osot. It was actually applied, swallowed, eaten, dripped, and done everything within 14 days. The patient could survive for more than a year. This was because in this case, cancer had already spread to the bone. Normally, if it spread to the bone and nerve, the patient can survive only for 5 months, then die. But in this case, she could survive for more than a year. She enjoyed eating and very happy. There is a real receptor. Like what she said that it was like in an action movie. It turned red around the lump because there was a receptor, right? The receptor really existed. Real receptor. Use THC and CBD to treat many diseases in a low doses. Use high doses for cancer cases. If it is in an ideal drug, it must be THC and CBD in a 1-to-1 ratio. However, we can do it. Having an outstanding medicine being used nowadays is great enough. There must be an optimal dosage. It is not good to use too much. Gradually use, slowly start. If the patient can tolerate it, keep giving too much is useless. Let's see why it can be used a lot. If there is only cannabis not being used with the other 28 medicines, I have to tell you, if there is only cannabis, the research is used only for dog case. Using 3 mg of THC per kilogram body weight, the patient will 100% die immediately. If 50% of death, the dosage will be 1.5 gram per kilogram body weight. There is another research reporting that 800 mg per kilogram body weight can also kill the patient. We have 810 mg of THC in a bottle. If we have only cannabis, the patient will not die for sure. Therefore, the way it works is to drip one drop gradually increase up to 12 times a day. Reducing pain is enough. 12 times meta-osod, 12 times a day, 12 drop. 36 milligram is equal to taking morphine for a whole day. Research has shown that CBG substance has popped up to treat brain cancer. Therefore, the route is important for us to continue. This is a brainstem cancer case in children who survived for 2.5 years. The lab result was all good. Therefore, if we have children cancer, do we have to operate to him? We need to think about whether we can use cannabis on this group of children or not. They do not allow us to use, but we will use it. After using it, he survived for 2.5 years. He just passed away peacefully. Then I will spread this case soon because it is a very beautiful case of palliative care with drama. He could pray until the day he died. So was his brain good? High THC and high CBD, but his brain was good. He could pray. We could not pray orally, but children can. This is a lung cancer. Do you see a big lump in the lower right lung? This is because of cannabis. It has been used for 1 year. The lump disappeared after using it. It was boring and not addictive, so stop using it. The lump was big. Then we had better recheck. After that, the surgery was done. The staging was only 2B. The patient could survive for another 4 years. She was an officer of Royal Provincial Public Health Office. PL is still alive. Now she said that she had not used cannabis. She used just a little bit to continue and balancing her health. The lung cancer cases, people say that the patient will die within 4 months. Why can this case survive for 5 years? This is because of cannabis. After that, she was rejected and re-diagnosed. Cancer did not spread. The tumor could be cut and continue using cannabis for a while. She has survived so far. Read the appendix at your own convenience. All of what I have said. If there is no case, they will accuse that I brag. But when there is a case, they will say that the doctor shared the information of patients. But with sincerity, in this study, I got permission from all patients. Is it imparting knowledge for the general benefit? If we cannot do anything, please remember one thing. Do not let them be in pain until die. Let them sleep, make them happy. Let them enjoy eating. How long a person can lie is not as important as whether they have a good quality of life or not. So I would like to end today's lecture. Thank you very much.